Hi, everybody. I'm just going to start the introduction before Beth starts speaking. So, my name is Eleanor Molloy, and I am the Professor of Paediatrics in Trinity. And I have been very lucky to work with Beth for the last few years, where she's the Programme Manager for the discipline of Paediatrics and Child Health. And although she initially was leading a project on neonatal brain injury, she has a long time had an interest in young people with Down syndrome. And she's going to tell you more about this in detail. And therefore, she coordinates our program called DISCO, which is an education and research program in the area of Down syndrome. But she's going to talk to you about the Happy Project, and I know she's going to explain everything in a lot more detail. And she is our lead for PPI in pediatrics in Trinity as well. So thank you, Beth. I'll go quiet now.
Great. Thank you, Eleanor. Um, so as Eleanor mentioned, my name is Beth Corcoran, and I've been a program manager in the discipline of paediatrics for the last 8 years, and I'm here today to speak to you about my master's in paediatric research, the Happy Project. Part of my role as PM is to coordinate the Down Syndrome Research Group, DISCO, that Eleanor referred to there. And the group is led by Eleanor, and it progresses paediatric research in the field of Down syndrome. And while I work in the School of Medicine, my own background is in the social sciences and humanities. And Eleanor invited me to become involved in the DISCO group from a PPI perspective, as I am mum to Rosa, who is 14 and who has Down syndrome. So apart from coordinating and program managing the group, I bring lived experience to the DISCO group and help promote PPI in this field of research. And there's our group there. So Rosa, who's you'll see here in some of her favourite Halloween costumes, has an incredible personality. She has a huge sense of humour and fun. And thankfully, she's a great sense of self and of who she is. And while she has none of the co-occurring health conditions that can come with the syndrome, we are very aware of the potential health challenges that may lay ahead for her. Also, she has a moderate diagnosis, which means that learning and retention of learning is a big challenge for her. As a mum, research gives me hope for a better future for Rosa, and hope that there may be care pathways and treatments for any health challenges that she may encounter. And I know that continued research in Down syndrome will ensure that Rosa will live a full and well life. You're probably aware that life expectancy of people with Down syndrome has increased in the last decades, and there's now an emphasis on living well. When Rosa was born, it was impressed on me early that early intervention was key in terms of physio, occupational therapy, speech and language, and a variety of health checks. And all of that to me as a mum made sense because, as we all know, the foundations for future well-being in adulthood, both psychological and physical well-being, are laid down. Those foundations are laid down in childhood. So the first few years of Rosa's life were very busy in terms of health appointments. And when I became involved in the DISCO group, I was impressed by all that was going on in the paediatric arena, because if we can get things right at the early stages of life, if we can catch things early, the pathway to adulthood will be easier. Studies have shown that people with Down syndrome wish to live independent lives. And if research helps us to resolve, treat, or support health challenges, there's a greater opportunity for our kids to have more independence and autonomy. Studies have also indicated that health literacy for our kids needs to be supported, especially as they are at risk of a wider range of well-documented health challenges. And studies have also indicated that parents like myself wish for their children to develop autonomy for both our child's sake and for our own sake as parents. The UN Convention of the Rights of Persons with Disabilities and UNICEF's Disability Inclusion Policy and Strategy support meaningful participation for people with disabilities in all things that impact them. And that, of course, includes research. So with all that background, the aims of my master's are to include supporting independence in young people with Down syndrome, fostering autonomy in young people with Down syndrome, and developing paediatric involvement in research. And today I will talk to you about the tools that I will use to achieve these aims. So those tools include promoting PPI in research using the HAPPY programme, assessing Down syndrome research priorities through a James Lind Alliance research priority setting partnership. I'll conduct a systematic review that will examine the status of children with Down syndrome and their participation in paediatric research. And some of our DISCO initiatives, I'll talk about them, and they will help us, they will support research dissemination. So last year, 2025, I was delighted to receive a Trinity Civic Engagement Award, which enabled our DISCO group, in collaboration with our advocacy partner, the Down Syndrome Centre, to devise and develop the HAPPY programme. The HAPPY programme is a health awareness programme that we designed to support health literacy in young teens with Down syndrome by informing them of current aspects of health research and giving them language and learning tools to help maintain their own health and self-advocate in terms of management of their health. We conducted several focus groups with the Down Syndrome Centre to identify topics that were relevant to people with Down syndrome, and we narrowed them down to these 6. There are obviously plenty more we could have included, but for this first run, we settled on these 6, and they included the anatomy. We thought it would be useful to give them, to communicate to kids or to our teenagers how the organs of the body function. We'd speak to them about the immune system. There are plenty of studies to show that the immune system for people with Down syndrome can be compromised. And we'd also speak to them for exercise for health. As a mum and through my own network of parents, we're very eager to keep our children physically active for their own physical and mental well-being. I coached my daughter's GAA team for 6 years, and I'm well in tune with the barriers that are there that exist for kids with Down syndrome accessing sport, accessing physical activity in terms of motor challenges, their focus challenges, and the need for additional support. Also, oral health. Our kids are sometimes prone to periodontal challenges. And of course, brain health. It's well known that people with Down syndrome are at risk of developing early onset Alzheimer's. So we thought it would be good to speak to the kids about some activities that could support brain health. And finally, sleep. Our kids are prone again to sleep apnea, and while they have no control over the sleep apnea itself, we thought it would be encouraging for them to talk to them about sleep hygiene and positive health or sleep routines. So we recruited Trinity experts in each of these fields, and we tasked them with devising and delivering a 45-minute workshop that would deliver a positive health message. In terms of the logistics of the programme, the Down Syndrome Centre already host a lot of extracurricular workshops and programmes for kids or their teens with Down syndrome, and they suggested that we slot this programme into that existing format and run it at their centre. They also recruited teens to the programme, for 17 teens to the programme for us through their network of families, and their staff agreed to support teenagers in the workshops. So our researchers then designed the workshop, and that included a lesson plan that I suppose identified a couple of learning objectives for each topic. They worked closely with the Down Syndrome Centre in terms of teaching methods to see what would work best with the kids, and it was visual cues, a lot of interactive and movement games and demos. And then they developed a take-home sheet to support post-programme learning and also to prompt discussion at home. As this was the first iteration of the programme, we ran it as a pilot and applied a quality improvement initiative to it. And this QI initiative consisted of collecting formative feedback from researchers, feedback from teens and parents, and hosting a final team review session. And the formative feedback and the teen feedback was collected after each workshop, and the parent feedback and the team review session was collected at the end of the program, the 6-week program. A few nights before the first workshop, we hosted a parent information session to talk to parents about the program objectives and to describe the topics and the learning objectives and to explain the QI initiative. We had already done this, outlined this in the PIL that we gave to parents, but we thought it would be useful to provide them with a forum that they could ask questions. We also asked them in this information session to send us some comments about the current status of their teens' health literacy, just to kind of get a baseline. And here's just a selection of some of the comments they submitted. My son is going through puberty and is very curious about the body. The program looks very helpful. It covers certain topics that I wouldn't discuss with my child. My son wouldn't have much, if any, knowledge about the anatomy. So that was just a flavour of what they said. We ran the workshops and everybody was really enthusiastic about them. The researchers loved engaging with the kids. Some of our researchers had plenty of experience of working with our kids, with people with Down syndrome, and others didn't. They hadn't had the experience of working with teens with Down syndrome before. So learning curve for everybody. And in terms then of our formative feedback, it became clear immediately that you were delivering learning to a variety of abilities. Some kids were happy to access the concepts at a top level, while others wanted to dig deeper and they had more questions about what the learning objectives were conveying. And this, of course, was a challenge to our researchers, but what helped them overcome the challenge was that we had a wonderful teen to adult ratio. As I mentioned earlier, the Down Syndrome Centre staff, they were supporting, 3 of them were supporting kids in the workshop, and we also had fantastic volunteers from the Teddy Bears Hospital to come out and help at the session. So most weeks we could provide one-to-one support. Of course, they noticed that they needed to allow time for regulation and movement breaks. So the objective of the session wasn't to kind of complete the workshop curriculum at all. It was to move at the pace of the teens. Each week we ran 2 sessions, 2 back-to-back sessions on the same topic. So the second iteration of the workshop each week gave researchers a chance to apply some of the learnings from the first workshop. In terms of the teen and parent feedback, teens completed an adapted accessible form after each session, and parents completed an online form at the end of the program. Both types of form they had a similar set of questions that addressed workshop format, content, and teaching. In terms of the teen feedback, as you can see here, we had the green bars indicate positive response. And so we did overall positive response from them. Obviously with the yellow and red and blue, room for improvement as always, but overall they felt safe in the workshops. They were happy with the workshops. They liked their teachers and they enjoyed the learning. In terms of the parent feedback, again, very positive response here, 5 and 4-star reviews for the program. And we also, I suppose, looked for qualitative feedback from the parents and got some very rich material there in terms of how the program worked for their teens. So you can see a sample of their comments here. My teen has taken some of the messages to heart already. Getting a good sleep routine and the importance of exercise. Great to see our teens pushed on topics that are not normally accessible to young people with Down syndrome. And we loved the info that was sent home. We found that we could use it to chat to our son about the topic. So that was great to hear that positive response. And in addition to those positive comments, they also provided us with some wonderful suggestions as to how we could further develop and improve the programme. You'll see their suggestions for other topics that we could cover: puberty, mental health, healthy eating and sex ed. Also, one or two topics may have been a little complex, and some modules went into a lot of detail, could be simplified a little. So we have to work on the accessibility of the material that we're delivering, look at breaking down the concepts so they are more accessible to the kids. And I suppose there was a common theme in all of the responses that referenced retention of learning. And that resonated with me as a mum in terms of Rosa's learning. And a request to repeat the workshops and the program with the kids to bring that learning home, to help them with the retention of learning. So we are hoping to do that in the future. In terms of the Happy Team review session, we met Down Syndrome Centre staff, our researchers and volunteers from the Teddy Bear Hospital. We met to discuss the successes and the challenges of the programme, and we came away with some recommendations as to how we could improve it in the future. Some of the things that we recognised early on, the teen to adult ratio was key to its success. The duration of the session, 45 minutes, and the programme itself, 6 weeks, worked very well for everybody. And one of the things that highlighted the success of this collaboration between Trinity as an academic institution and the Down Syndrome Centre as an advocacy group was that Trinity researchers confirmed that they could not have done this, they could not have delivered this programme without the wonderful support of the Down Syndrome Centre staff. The staff could help kids engage with the learning as they were familiar with kids, and they knew when someone needed a break or a little time out. And in return, the Down Syndrome Centre staff said that the kids were really excited to have new faces come in to present to them, because normally it's the centre staff that deliver the extracurricular workshops. So that was a great benefit to the kids at the centre. And also the Down Syndrome Centre staff learnt a lot in terms of activities and ideas from the Trinity researchers that they could bring again to workshops that they run with the kids. In terms of recommendations going forward, we thought we could use some more law of signs and that we could share the Hannon communication strategy with researchers in advance of running the programme again. We can also work on our learning objectives, making them more accessible by making sure they're related to each other. And again, the take-home piece, the retention of learning, maybe some rewards for practicing the learning objectives at home, and maybe some more prep in terms of a one-page handout in advance. And again, modifying complex terminology. So plenty of ideas there for improving the programme. Overall, we were delighted with the success of this pilot programme. I've presented on it at the HSE PPP conference last September, and also at Monaghan's Science Festival. I presented it to Hub 21. We do hope to run the programme again at the Down Syndrome Centre, subject to funding. We're looking for funding at the moment to run it, but we were thrilled with its success. I'm also part of the DISCO team that will work in partnership with the James Lind Alliance to develop a global top 10 of research uncertainties that will be determined by the wider Down syndrome community. The wider Down syndrome community consists, of course, of people with Down syndrome first and foremost, and their advocates, people from the medical and scientific and research communities who work with our kids or who conduct research on their behalf. The partnership brings representatives from each of these branches together to provide them with an equal voice in determining the research priorities. The James Lind Alliance process in determining these creating this top 10 list, the process involves the following steps. First of all, we establish a steering committee. We find that evidence uncertainties, we summarise the responses, and then we check the evidence, and from that evidence we create a short list which evolves into a top 10 list, and finally we publish the results, and from that published list of results we'll be able to develop research questions, and we'll have evidence to approach funding agencies that this is what matters to the Down syndrome community. Our operational group includes Eleanor, who leads the project. I'm the coordinator, and Rob McCarthy is the information specialist, and he will analyse the data that's collected by the survey that's developed. Aoife Moran is a PhD scholar on the project, and also Toto Grunland is from the James Lind Alliance, and she will chair our steering group meetings. We expect to run 10 steering group meetings over the course of the next year or so. And I'll just talk a little bit about my role as coordinator, which includes developing our networks and our relationship with advocacy groups. So we've already worked with Down Syndrome Ireland and the Down Syndrome Centre here in Ireland. We've worked with them closely in a lot of our projects before, the Happy programme being one of them. And over the last 6 to 8 months, I've worked very closely with Down Syndrome International to recruit international representatives to this project. We also have attended the Down Syndrome Medical Interest Group winter meetings for the last few years. And we're going to be asking all of these groups to help us on this project by, first of all, at the start of our programme, nominating steering group members. In the middle of the programme, we'll ask them to assist in promoting the PSP survey. And at the end, we'll ask them for their help in disseminating our results and publicising our results. Our steering group, which will lead the project, it's very important that it has people from a variety of socioeconomic and cultural backgrounds, and that it has a diverse reach. So we're delighted to say that our steering group currently has representation from Ireland, the UK, Jordan, Kenya, Mexico, US, and Australia. And our first steering group meeting takes place directly after this presentation. So we're very excited to get going with that. The systematic review that I mentioned as one of the tools, my systematic review will look at children with Down syndrome and their participation in health-related research. There's evidence that involving children in research not only improves research, but also gives a greater understanding of childhood. In terms of people with disabilities, studies have also indicated an increased confidence, self-esteem, an increase in self-esteem and independence in people with disabilities when they are included as co-researchers. And again, that ultimately leads to better research. Unfortunately, despite these documented benefits, there appears to be little evidence of children with disabilities being engaged as co-researchers. And my systematic review will specifically look at children with Down syndrome and their participation in health-related research. So far, I have screened just over 1,000 studies with help from staff in the Children's Health and Research Lab, and I will look at 33 of those more closely. So I'm just at the early stages of that systematic review. And the fourth tool I am using, which will help to disseminate research and which will support the aims of my master's, are DISCO PPI initiatives. Last March, we hosted the Future So Bright, which was a fantastic evening that saw us invite people with Down syndrome, their families, researchers and professionals who work with our kids to Trinity to learn about recent developments in Down syndrome paediatric research. The objective of the evening was to raise awareness of research, foster collaboration in research, and communicate the value of PPI involvement in research. The evening was chaired by Professor Eleanor Molloy and Dr. Joanne Balfe, and it was opened by Ross O'Neill, a young man from Down Syndrome Ireland's National Advisory Council. And he spoke about the value of research. We also got an opportunity to introduce one of our DISCO research ambassadors, seen here on the right with me, Andrew McCarthy, to the audience. Andrew and his brothers Joe and Paddy have very kindly agreed to become ambassadors to promote the need for research in this field. We also heard from many excellent research in the paediatric arena, including Dr. Rob McCarthy, who spoke about developments in immune research, Professor Orla Franklin, who gave an update on the latest in cardiac research, And Fiona McGrain, who is nurse specialist at the Down Syndrome Research Clinic, she spoke about clinical learnings from that clinic. And Professor Eleanor Molloy, gave an overview of the Down Syndrome Research Group and its objectives. We had a great evening. We had 80 parents, advocates attend, and there was great audience engagement. Parents were really eager and hungry to learn about all that was happening in the various areas of research, and the discussion went on for a lot longer than we expected, which was fantastic. And we also had catering. I'm going to give them a plug here now. Catering from the Together Academy, you'll see down there in the right-hand corner, which is a catering college for adults with Down syndrome. And some of their students, you'll see Ben there in the corner, came to serve the food, and this really enriched the evening as well. So we were delighted. And we hope to run another evening like this this coming spring, and I will hope to have details in the coming weeks about that. Even I'm just finalising logistics on it. And the evening will give an update on other areas of Down syndrome paediatric research, and it will also give an update on what has happened in terms of Down syndrome research in Trinity in the last year. And one of the exciting things that has happened in Trinity is the establishment of the Trinity 21 network. That's the Trinity Down Syndrome Research Network. This is a university-wide collaboration that's led by TCAID and our DISCO group. And we held our inaugural meeting in November. And the objectives of the group include fostering collaboration across disciplines, across schools, across faculties, and translating research into real-life impact. Also showcasing Trinity's leadership in Down syndrome research and building a connected community committed to improving the lives of our children. I'm very excited about this network. As a mum, Rosa's well-being includes positive health outcomes, access to education, access to employment later on in life, and social inclusion. And this network has the potential to address and provide research in all of these aspects. At the meeting itself, we had amazing contributions from Dr. Emer McGlinchey, from Professor Eleanor Molloy, Professor Mary McCarran, and Dr. Maylin Yap, and many other academics and PhD scholars across the university. The audience included representation from all areas of the university, from our discipline of paediatrics, from the Trinity Centre for Ageing and Intellectual Disability, from our PPI Ignite office, the School of Medicine, the School of Nursing and Midwifery, many of our institutes, Global Brain Health Institute, TCIN, TBSI, School of Computer Science, Education and Pharmacy, the Faculty of Business, or the School of Business, and from our TDA office. We have 60 researchers who have registered interest in the network, and we expect to host biannual meetings. So you'll be hearing more about this network in the future, now that it's on everybody's radar. Here's just a sample of some of the presentations that were made at the event, and we also had some great PPI discussion. And just a reminder that in the coming weeks, I hope to be sending out information about our next PPI event. So I'll pass word on to Trick, of course. And I just want to thank, in particular, Professor Eleanor Molloy and all at the Child Health Research Lab for their support with my master's. I want to thank all the researchers in Trinity who contributed to the Happy programme, to the wonderful staff at the Down Syndrome Centre staff, and to the teens and parents who participated in the programme, to our collaborators at Down Syndrome Ireland, Down Syndrome International, and the James Lind Alliance, and also to those behind the Trinity 21 network, Gavin Dan, Professor Mary McCarran, Professor Eleanor Molloy again, and Dr. Emer McGlinchey. And finally, a big thank you to Rosa, who I guess is the inspiration behind my involvement in Down syndrome research. And thank you for listening.
Oh, congratulations, Beth. That was a fantastic overview. I am very honored to work with you now, and I think you explained everything so well. You forget how many things you've done since you've been working in this area. It's kind of amazing, and we're so lucky that you have done this. I was going to say to everybody online, we actually, because of the way it's set up, can you put any questions or comments in the chat, and we'll answer anything that you wish. I meant to say that at the beginning, and I don't know if there's any comments anyone has to make. I think the other thing I was going to say is, as you can see, Beth has managed to recruit everybody when she's doing her projects. So I think if you have any interest in any of these areas, that if you just email Beth, and her email is there, she will make sure you're included.
Yeah.
Yeah, sorry, Beth, you go ahead.
Yeah, no, I'd be delighted to give information on anything I've discussed here, or indeed if you want to know more about the Disco group itself or the Trinity 21 network, you can email me here and be delighted to answer any questions that you have.
And I think the Trinity 21 group, although it says Trinity, we just started it like that because we suddenly realized within the university there was so many people doing research in this area. But of course, it's going to be inclusive in a much broader sense of other universities and other people. It was just started off that way. So if you know anyone who might be interested, it is very inclusive, isn't it, Beth? I think.
Absolutely. You're right, Eleanor. This inaugural meeting was just, I suppose, to get an overview of what was happening in Trinity, but obviously we appreciate and are very interested in what's happening in other universities and what's happening through our through the advocacy groups and everything, because they play a key part, as well as you saw from the Happy program, in helping us deliver things directly to the kids with Down syndrome. So yeah, we're definitely going to expand it out to other universities and anybody else who's interested.
And I suppose other key things that are happening, I know because I see people from Down Syndrome Ireland online, is that we're going to try to get involved with the Down Syndrome Ireland new strategy and see if we can assist in any way with that. Now, I can't see any comments in the chat, Beth, if you can.
No, I think
no questions. You answered every question. It's always a good sign, I think. I think it means you explained everything so well and so carefully that no one has any questions. But maybe we should let you all go. And Beth, I just want to say thanks a million. That was a fantastic presentation, beautifully put together.
Oh, thank you, Eleanor.
Edna has just texted me to say the chat is disabled. So I'm sorry, there probably are questions. I don't know if the chat can be enabled. But maybe, because I think unfortunately Beth and I don't have control over it. But
no,
I
sorry,
get a
I
comment
can't do
from
it
Edna Roach, and she's saying excellent talk and well done. So there you got some congratulations
thanks,
by
Edna.
text. So that's lovely.
You.
And then Nicola Hart said, great presentation. Thanks, Beth. Fantastic. And thanks so much for an excellent. So it's lovely thank yous there from Fiona Doolan.
Thank you very much.
Yeah, and Liz Nixon. So so this is great. We'll have to keep that all for you afterwards. But I just want to say thank you again, Beth, and thanks to everyone for listening. It was a fantastic overview.
And thanks a million for the opportunity to present on it.
Yeah, thanks to Trick. Thank you very much.
Thanks a million.
Bye.
Bye.